Hello, I'm Dr. Heather Woolery-Lloyd. I'm a dermatologist in Miami in private practice and at the University of Miami. I'm here to talk to you today about hyperhidrosis, a condition which involves excessive sweating. If you think you have hyperhidrosis, you're not alone. Nearly 1 million Canadians suffer from hyperhidrosis, many of whom do not seek treatment either because they're unaware that this is a common and manageable condition or because they're too embarrassed to seek help. I'm here today to educate you on this condition and make you aware that either you or someone you love can take control of this problem in a surprisingly simple way. Hyperhidrosis is a medical condition characterized by excessive sweating. It can occur anywhere on the body, but is most common on the hands, feet, and underarms. It is not caused by nervousness and is a true physical medical condition. But take heart, if you suffer from hyperhidrosis, there are treatment options available. Now that you know a little bit more about this condition, let's talk about who gets hyperhidrosis. The short answer is anyone can have hyperhidrosis. It is seen in both men and women and people of all races. Many people often have a family history of hyperhidrosis. I treat hundreds of patients with hyperhidrosis, and the one thing all of these patients have in common is embarrassment. Many patients will only wear black to hide stains and wetness from excessive sweating. Other patients will avoid social events for fear of shaking hands. The good news is there are treatment options available. There are many treatments for hyperhidrosis. A simple and very effective therapy is topical aluminum chloride, which is significantly more potent than regular aluminum antiperspirants. This treatment is applied nightly for several nights and then as needed to control hyperhidrosis. For many patients, this is a very effective therapy. However, for some patients, combination therapy with other treatments is required. BOTOX injections can be performed to treat hyperhidrosis of the underarms, hands, and feet. These injections need to be repeated at 3 to 6 month intervals and are very effective at treating this condition. Glycopyrolate is a prescription medicine that is taken by mouth to treat hyperhidrosis. This needs to be taken daily and can have some side effects, but it can be quite effective for short-term use. There are surgical therapies to treat hyperhidrosis. Sympathectomy is a serious surgery that involves cutting the nerves that cause sweating in the hands. Liposuction can also be done to destroy the sweat glands in the underarms. You should see a dermatologist to treat your hyperhidrosis. Together, you and your doctor can decide what treatment works best for you. Hydrosal is a topical aluminum chloride antiperspirant. It was developed by a dermatologist to treat hyperhidrosis. Unlike other topical aluminum chloride therapies, Hydrosal contains salicylic acid, which improves its effectiveness. It also appears to be less irritating. In my practice, many patients who have failed other topical aluminum chloride products find Hydrosal to be well tolerated and very effective. Hydrosal is easy to use. It is applied at night for several nights. For those of you with occasional sweating made worse by stressful situations or social events, it can be used intermittently. For those of you who suffer from chronic hyperhidrosis, after the initial week of therapy, it is used as needed. Washing in the morning does not reduce its effectiveness, and other antiperspirants are not needed. I am often asked if Hydrosal burns. Hydrosal is not an alcohol solution like most other aluminum chloride products and therefore has a lower risk of irritation. In my practice, I see less irritation with Hydrosal. While it is always helpful to consult with a dermatologist regarding Hydrosal, it is not absolutely necessary if you just want to try it. In Canada, the product is known as Hydrosal GEL, and you can find it at any pharmacy. It is not located where all of the other antiperspirants are located, and it's actually behind the pharmacy counter. You don't need a prescription, just ask the pharmacist for help. You can also go to the Canadian website www.hydrosalgel.com and purchase directly online. Outside the US and Canada, the product is known as Hydrosal GEL and can be purchased at the website hydrosalgel.com. For more information on hyperhidrosis, visit the websites sweathelp.org or hyperhidrosis.ca. Thanks so much for listening, and please don't suffer in silence. Visit a dermatologist as soon as you can. You will be glad you did. You'll find these helpful videos on YouTube, hydrosalpro.com, and hydrosalgel.com.